Mi nombre es Elizabeth y tengo una condición en la cabeza de unos granos. Pienso que tengo aproximadamente 100.
Oh, poor woman.
Dos granos del tamaño de una blueberry. Nunca me imaginé llegar a como estoy ahora.
Wow, I have never seen a patient like this in my practice before. So first question is what are these huge masses on her head? My first thought, and whenever you see something that's just so common, like all over the place like this, would be neurofibromatosis. But I'm not sure that that's the case because neurofibromas oftentimes are rounder in appearance than what she has. So if she came to my office, the first thing I would do is biopsy one of these lesions to see exactly what this is.
The bumps that bother her the most is on her left side, regardless of what side she sleeps on.
That cannot be comfortable to sleep on that. I mean, it's huge. It's on the one side of her head. I mean, for me, I'm a side sleeper, so I often sleep on my right or my left, and to not be able to sleep on that side of your head, that's tough. I feel for her, and I hope that Dr. Pimple Popper will be able to really help her out.
Oh my goodness. How long have you had this going on?
53 years.
Does anybody in your family have this?
Yes, only my father.
So it appears that this is a congenital abnormality where you inherit this genetically through your mother or your father, and it sounds like she got this from her dad. So once again, what could this be? Offhand, I don't know that this is neurofibromatosis. I feel like this is something else, and I just haven't quite figured it out yet. Let's see what Dr. Lee thinks it is.
Yes.
So they've been removed before. Did they grow back or did you get other ones?
No, other one.
Obviously, the option for her would be to have these excised. And the fact that they were excised and other ones grew back in some ways can be a good thing because it means that there is hope for her that you can cut these out and they're not going to regrow in the same place. But there are so many of them. How are you going to tackle all of these, especially at one time?
They are just kind of sitting on a smaller base. So in a way, it looks bigger than it actually is stuck to her.
So that's good news. If they are on an actual stalk, where a stalk is a thinner portion and then it comes out, that makes cutting them out so much easier. The problem is that this part of the face, really anywhere on the face or the head or neck, is very vascular. You can get a lot of bleeding when you cut things off, especially when you're around the scalp area.
These look a lot like a condition called cylindromas that goes along with a hereditary condition called multiple trichoepitheliomas.
So she knows this because Dr. Lee is a dermatologist. As a plastic surgeon, this is not necessarily my field, but I do know what cylindromas are. And these are usually benign tumors that can grow, usually in women. It's like women are, I think, 5 times as likely to have this as men. And there's 2 kinds. There's a solitary cylindroma that some people get, and then there's the multiple ones like she has gotten where they've grown really all over these areas. And the treatment for this typically is excision. You have to cut them out.
Cylindromas are dome-shaped tumors. It may look a lot like a cyst that you would see me remove commonly, but there's nothing to pop. It's just solid.
The reason why they're called cylindromas is if you look at them under a microscope, it looks like the cells are clustered in what look like cylinders. These things don't look like cylinders at all on the surface, but it's actually more microscopically that's how they look like. And these are inherited in an autosomal dominant fashion, where if you get one gene for it, then it will pop up and you will have this issue yourself. So hopefully this is not something that she gave to her children, and maybe then it's just outside of the family line completely after that. Would you like to look 5 or 10 years younger, but you don't want to go under the knife or needle? Well, what if I told you that you could use your body's own natural regenerative abilities to turn back the clock in a major way? It's a process called autojuvenation, and it's the culmination of 20 years of me being a holistic plastic surgeon. I reveal this groundbreaking approach in my new book, Younger for Life. In this step-by-step guide, I show you how, through simple changes in diet, activity, and skincare, you can reap huge changes in your skin and look younger than ever before. Best practices for sleep, exercise, luxurious thick hair, beautiful teeth, and mindset. And a simple 3-week program to jumpstart your autojuvenation process to look and feel amazing. Why wait to turn back the clock? Please order Younger for Life at autojuvenation.com. The link is in the caption below.
They're right on top of each other. I have to really delineate each individual stalk and try to remove each stalk one by one.
Now, I have the utmost respect for Dr. Lee. She is actually a good friend of mine, and we DM each other all the time. As a plastic surgeon who does all of his operations in an outpatient surgery center, I would probably deal with this a little bit differently. I would have her completely asleep, and then I would just start lopping these babies off. Definitely having access to general anesthesia and being able to put the patient to sleep can allow you to do a lot more at one time than if the patient is awake. That being said, there are some patients who don't want to undergo a general anesthesia, and having it done awake they would prefer because they're afraid of the potential risks of being put to sleep.
It's as if Elizabeth has a whole head of cauliflower stuck to her scalp, and so the first thing I'm going to do is debulk it to be able to see what's going on underneath.
Oh my gosh, it does totally look like cauliflower growing on her head, doesn't it? Now, the only other time that I treated somebody where it actually looked like they had cauliflower was this poor young guy who I saw in the clinic when I was a resident, and he had genital warts growing all around his groin, and it honestly looked like sprouting cauliflower down there. I mean, I felt so bad for this guy. I don't know how you deal with that other than you just cut it all out.
Yeah, when you move this gauze, it starts to want to bleed again. Yeah, let me buzz it a little more. Yeah, I agree. I agree.
Like I mentioned earlier, the head, especially the scalp, does tend to bleed a ton when you're cutting things out of it especially. And so doing this with her awake, in that controlled fashion, definitely you're going to be limited in how much you can do because you don't want to get into a situation where there's so much blood that's coming out that you can't control it. And as big a procedures as Dr. Lee does in her office, I really have to hand to her that she really has good control of some pretty big procedures there.
Mi operación con la doctora Lee, que todo estuvo bien.
Wow, that's impressive, especially done under a local anesthetic in an office setting like that. Obviously, she's got other ones that can be taken off, but she's gotten rid of that large mass there, so hopefully she can at least sleep on her side now.
Después de la operación me siento más segura y me siento mucho mejor en público. La doctora Lee me hizo mucho más de lo que yo pensaba.
Well, great job with Dr. Lee. I'm really once again impressed with how much she can do as a dermatologist in an office setting like that. As a surgeon, I would bring them to surgery and just start lopping things off, but it's a whole other deal in that situation. So this woman had growths on her face that were really, really impressive. But what about feet that are really impressive? Believe it or not, Dr. Pimple Popper treats feet as well, and this is a set of feet that you've got to check out. Take a peek at it right up here, and remember, eat real food, use clean skincare, and auto-juvenate before you operate.